Michael Greenberg, Chairman and Chief Executive Officer of FIO Corporation, one of the co-applicants for Genome Canada project. We're focused on infectious diseases, and we address two problems. One problem is that at point of care, which is where the doctor and the patient, or the caregiver and the patient meet, the level of accuracy of a diagnostic strip is way less than in a central lab all over the world. And yet, that is the commonest place, and probably economically the most efficient place where you want medicine to touch patients with infectious diseases. A second, apparently unrelated problem, and yet very significant, is that healthcare systems, whether they're private or public, spend hundreds of billions of dollars a year, and those decisions, those resource allocation decisions, should be evidence-based, should be informed by data, should be informed by information coming from point of care. Right now, there's very poor accuracy at point of care, and there's very little information flow from point of care to health program managers. We've created a technology based on the combination of smartphone technology, which includes communication systems, GPS, etc., biotechnology, and some nanotechnology to create a solution where the diagnostic strip at point of care is read not by a minimally trained health worker in a variety of lighting conditions and very hectic pace in a clinic, but is instead read by this device, which we call a smart reader. Thank you, Vanna. That device takes a field accuracy of today from about 60-65% on average. Well, it's not very high, to a very, very high level of diagnostic accuracy, which means that you know what the patient has, you know what you're treating. And the kinds of figures that are quoted today, which is that in Africa, $1 billion of an anti-malarial drug goes to people without malaria, should disappear. At the same time, this device collects information not only of the diagnostic strip, but the health worker uses it to be guided in asking the patient questions. All the things that they normally do anyway is guided through this device and transparent to the health worker. It automatically uploads all that information to a very secure database that we've created as well, and which in turn is accessible by health program managers sitting at their offices, and all they need to do that is authorization from us as a client, but all they need equipment-wise is a computer and an ordinary web browser, and they can now mine data, analyze, do surveillance, have the information that should drive their decisions, whether they are a program manager of a bunch of private clinic chains or a Ministry of Health or a global international organization overseeing or funding healthcare. So it is the fusion of digital diagnostics at point of care with web-based information services. In all cases, we're using technology that currently exists to deliver a first-of-its-kind solution. Genome Canada helped us by designing the next generation of diagnostic strips, which instead of testing for one disease can test for a number of them organized around the patient's symptom at a very high level of accuracy.
Just kind of